NTV, turning on your world.
Good morning and welcome to NTV Tizi Nyumbani. My name is Peter. I'm joined by Nelly today. We'll be doing a bottled water workout. So all I need you to have, like I told you, juicy on our last workout. Then I need you to get a bottle this small. You can inaweza kuwa ni maji ya 500 ml. It could be the soda bottle, any bottle depending on your weight. All right. Welcome on board. We start with a small warm up for at least 2 minutes. Then we kickstart our workout. Okay? Perfect. So tunaanza na jumping jacks. We're here. Perfect. If you have any injury and you cannot be able to jump as fast, or at least take your arms up that farthest, just go here. Hapo. Okay? Easy. Do what you can. If you have an injury, we don't want to aggravate it. We're just here to help you work out and keep fit at home. Okay? Perfect. Let's go. 10 more. 9 more counts. 8 more counts. 7 more counts. 6 more. 5, 4, 3, 2, and we're here. We're jumping here. Perfect. You're here. Hapo. 1. Twende kazi. If you can skip, perhaps because of knee issues or anything like that, or even sometimes coordination inaweza changanya sana, all I need you to do, just step on the side and just touch. Step on the side and touch. Step on the side and touch. Okay? Step on the side, touch. Step on the side. Hapo. Easy peasy. Easy, easy hapo. If you can go as low, just go the farthest you can. Hakuna shida. We just want you to be mobile. We want you to be active. That's it. Tuendelee. Good job, Nelly. 5 more. 4 to go. 3 to go. Last 2. And last 1. Good job. From there, tunafanya mountain climbers. 50 mountain climbers for a warm up, then we stop. Nelly, get into position. Good job. You ready? Twende kazi. 1. Remember, you don't have to go that fast. If you can go slower and make it effective and work for yourself, that's what we want. Sawa. But if you can make it much more faster in terms of pushing those legs in and out faster, the more faster you go, the more intense the workout. Okay? So push it. Perfect, Nelly. 20 more reps. Push it, guys. Don't quit. Don't quit. You're doing 5. Push it. Push it. Push it. 5 to go. Good job, Nelly. Good job. Perfect. Smama. Now, our first workout. How are you feeling? Perfect. Our first workout today, like I said, we're working on the upper body only. Upper body being your shoulders, your arms, your back, your core, and all that. So we're starting with the biceps. Today we're going to do something we call a bicep curl. We'll combine it with a bicep hammer curl. Okay? So now, you can have any bottle that you have depending on your weight. Inaweza kuwa hii ya chupa ya soda 500 ml ama even a bottle of liter umejaza maji or anything. Okay? So now we're starting. The difference between a curl, this is a curl. Hammer curl comes up straight as if you're hammering something. Hammer. All right. So now Nelly, we're starting with one single hammer curl. Sorry, one single curl, one single hammer curl. We're doing 20 reps. Hammer. Okay, so we're starting now. Twende kazi. That's 1. Give me a curl. Give me a hammer curl. That's 2. Give me a curl. Give me a hammer curl. 3. Now give me some speed. Curl. Hammer. 4. 5. 6. I don't want this movement. Hapa kusonga hata kidogo. It's firm. There. Sawa. Hapo. Good job. So lock that elbow, lock the elbow there, make sure here there's no movement. Upper, on the side, Nelly. Tuendele, upper. I don't want any movement here, iko firmly there. Good job, guys, let's go. Push it. 10 to go. 9 to go. 8 to go. 7 left. 6 to go. Last 5. Push it, push it. Last 4, this is where we targeting, guys. This is a bicep muscle. Bicep, twende kazi. 4 to go. Last 3. 2 more. Last count, twende kazi. Good job. How are you feeling it? Perfect. Awesome. From there, tunaingia kitu tunaita tricep kickbacks and a tricep overhead. Now, a tricep kickback, this is a tricep muscle that we're working on. You're kicking it back. A tricep overhead extension, tunaileta juu ya kichwa. We're pushing it all the way up to the roof. Sawa sawa. Good job. Twende kazi Nelly. What? Straight out the arm kabisa. Straight it. Yes, kabisa kabisa. Perfect. This is what we're targeting, guys. Twende kazi. 15 to go. 14 left. 13. 12. 11. Push it. 10. 9. 8. 7. Remember, I don't want to see you swing at all. Mwili yako iko firm hapo. Hapa peke yake. The engagement is here. 4 to go. Last 3. Last 2. Last 1. Good job. Relax. Relax those arms. From there tunaingia overhead extension. Same. Unaweza shikanisha those chupa mbili. Kama unatumia moja mzito, shikanisha mkono hapo. And from there, look at me. I'm actually just doing it on a squat position because I want to engage my squats kidogo. But I'm there. And that's the movement I want. Okay? Overhead, kabisa. Nelly, you ready? Yeah. Good job. Twende kazi. Push it. Perfect. Upper. Straighten it up. Kabisa straight. Twende. 18 to go. Twende. Good job. Good job. Let's go, guys. 14 left. 13 to go. 12 more. 11 to go. Nelly, you're doing fine. 10 to go. I know. Feel it. 9 to go. 8 left. Push it. 7 more. 6 to go. Remember, we're doing our triceps, okay? We're engaging the triceps. Tumeanza na biceps, sasa tuko triceps. Push it. Good job, 3 more. 2 to go. And last one. Good job. Relax. If the water bottles are too heavy for you, you can take something lighter. Sawa. These bottles are 500 ml. If you have something lighter or if you want something heavier, depends on your workout fitness level, okay? Depends on your fitness level. Perfect, guys. From there, tunaingia deadlift with the front raises for the shoulders. So now we're targeting our lower back. At the same time, we're engaging our shoulders. Sawa. So we're starting on a deadlift, then front raise. Deadlift, front raise. Let's go. Those are 3. Good job. Come up, simama straight. Come up, twende chini. Come up, simama straight. Perfect, then perfect. Remember, those front raise, isipite shoulder level. Sawa. Don't extend it beyond the shoulder level. Just shoulder level. Perfect. Simama straight. Up. Again. Simama straight. Then up. Good job. 13 to go. Push it. Remember, if the front raises are too hard for you, in case of the weight or in case of the water bottles are quite heavy, put them chini. Do it on your own body weight. Sawa. Deadlift there. Then front raise. Remember the posture for the deadlift. Easy knees, shoot your bum backwards, chin forward, chest out. Apo. I want that safety of the back. Mugongo ikae hivi mzuri, yeah? Arch that back. Good job, Nelly. Let's go. 8 to go. 8 more peke yake. 7 to go. Push it. You're doing fine. Good job. 4 to go. Don't quit. She's doing it. You can do it. Let's go. 3 more. Good job. 2 to go. Give me the last one. Twende kazi. Good job. Relax. Remember, kama wewe uko advanced level, you can do as many reps as possible. You don't have to limit yourself to 15 or 20 reps. If you feel you can do 25, still at the same timing as we're counting for the rest, please push it harder. Sawa. So if you finish before us, push yourself, okay? For the people who are just starting, for the beginners, intermediate and all that, 10 to 15 reps is enough, okay? You ready, Nelly? From there, we're doing a raised arm circle. So you raise your arm straight, then you circle. you circle, you circle. Remember, if the weights are too heavy, you don't necessarily have to have them, okay? Perfect. Twende kazi. Push it. Take it up, up, hapo, down. Good job. Those are 6, 7. Tuko hapa, shoulder bado guys. Twende kazi. Those are 10, 10 to go. 1, 2, twende, push it. 3, 4, 5, 6, 7, 8, 9. Give me 5 more. Twende, 5 more. 5, 4, 3, 2, and 1. Relax those arms. We are back to the biceps again. This one we're doing something we call a concentrated curl. Hapa. Look at the posture. Your elbow locks in here. Apo. Sawa sawa. You can do it seated down on a seat. Kama in case you have knee issues or knee injury or anything, you can just take a bench, keti chini, then just lock your elbow hapa kwa hii mguu. Sawa sawa. Then I want a full range of motion. Mkono iende all the way down, then back up. Perfect. Chini, up. Chini, up. Those are 2. Twende kazi. 3. Give me some speed, Nelly. Let's go. 4, 5. Good job. Let's go, guys. 6, 7, 8. Push it. 9, 10. Breathe. 10 to go. 1, 2. You're doing good. You're doing good, guys. You're doing good. You're doing good. Twende kazi. Don't quit. That's 5 more. 4, 3, 2, and 1. Perfect. Relax. Change to the other hand. Same. 20 reps. Okay? Remember, lock it there. Hapo. Hapo. Nelly, I want you to face the camera that side. Hapo. Nataka wakuone. Hiyo mkono ya left. Hapo. Twende kazi. You see what Nelly is doing? That's exactly what I want you guys to do. Twende hapo. Full range of motion. Iende chini, irudi juu. Twende. Twende. You're doing fine. Yes, twende kazi.
It hurts.
Twende, I know. The burning sensation, eh?
Yeah.
7, 8, 9. Those are 10. 10 to go. 1, 2, 3, 4, 5, 6. Good job. 7. Good job. 8, 9, and 10. Relax. Breathe. Perfect. Tumemaliza bicep. Tunarudi wapi? Tunarudi tena triceps again. Now, we're doing the tricep push down. Imagine you're in the gym, you have this machine ahead of you, hapa mbele yako, umeshikilia the cables, and you're pushing it down. Okay, now we're using the bottles. So you have your bottles here. I want you to face this side, face on the side. Perfect. Hapo. Relax. Remember your back. Don't arc it much. Just a little bit. Hapo. Kama tu venye unafanyia kwa gym too. There's not much difference. So we're here, pushing it down. Easy. Easy. Feel the movement. Easy. Yes. Up. Good job. Those are 4. Twende kazi. 5, 6.
Oh, it burns so much.
7, 8. Twende guys. Push it. 9. Good job. 10. Bado tuko hapa. 10 more. 1. When you're complaining hizi mataya, sijui nini, these are the workouts guys. Biceps, triceps. Tunachoma hii. 7 to go. Twende kazi. 6 left. Last 5. 4 to go. Good job, Nelly. Let's go. 3 to go, guys. Push it. 2 more. Last one. Relax. Tuko hapa. Good. Now, I'm gonna place. I want Nelly to sit here. Good job. Katie. Now, we're getting into a Russian twist. Sawa sawa. Songa nyuma kidogo, Nelly. Just move backwards kidogo. Perfect. Now, we're engaging the sides, the core, hapa. Sawa sawa. We're doing something we call the Russian twist. Hapa. I want those bottles to go all the way down. Chini. Ziguze chini. Ivo. Good job, Nelly. Push it. Push it. Twende kazi. Twende kazi, eh? If you feel you want to challenge yourself, you can take your legs up a bit there. Sawa sawa. Apo, I know. Twende kazi. Push it, push it, push it. If you want to challenge yourself up, just raise your legs up a bit, then just engage the core and twist to sides, okay? Twende kazi. Push it. Don't quit on me, guys. You can't. You cannot even try. Huwezi hata fikiria kitu kama hiyo. You cannot fathom such. Never. Twende kazi. 10 to go. This one we're pushing it at least 30 reps. 20. 8 to go. 7 to go. Good job, Nelly. 6 to go. 5 to go. Those who complain is mataya, she's doing nini, we're strengthening our core, we're working on our core. Twende kazi. 4 to go, Nelly. Last 3. Push it. Last 2. Last 1. Perfect. Relax. Catch your breath. Relax. Now, from there tunaingia shoulder planks. So, I want you to have your bottles hapa mbele yako. Just press them hapo tu mbele yako. Okay? You have them there mbele yako. So now, we're doing a shoulder tap. This is basically a shoulder tap. Hapo. Sawa. Your hands are straight. Your legs are straight. You're facing. Yes, guys, Apple. Already engaging the core just by the virtue of you being there. So if you can do what I'm going to demonstrate next, just stick there. You're doing the right thing. Okay, so we're doing the shoulder taps. So you tap right, tap left, take the water, face up. Apple. Sawa. Then you change. Tap, tap, the other hand, and up. Then shoulder tap, then the other hand, and up. Perfect. Nelly, we ready? I'm ready for you. Are you ready?
No.
Are you ready?
Yeah.
We're starting. Get ready. Sawa sawa. Do what you can, guys. If you can't go that much, just hold it there. It's still a good plank. Turn, Nelly. Up. Face up. I want you to twist your body and face the roof. Perfect. Turn there. Tap. Tap. Take the water. Up. The other one. Up. Good job. Those are 2. Turn, Kazi. Push it. Good job, Nelly. Try to twist your body. Kabisa, kabisa. As you face up, twist it. Ivo. Keep the hand up to the ceiling. Turn, Kazi. Those are 4, guys. Turn, Kazi. Control the weight of the water. Yes, Ivo. Those are 5. Turn, Kazi. 10 more to go. Those are 6. Yes, I'm counting. The other side. Those are 7. Turn the Kazi, to go, Nelly. Doing well. You're doing well. Turn there. Up. And up. Those are 8. 7 to go. 6 to go. You're doing fine. Don't complain. Do what you can. If you can't be on that plank position for long, put your knees down on the mat and just stretch it out. All right. Whatever you do, don't stay still. Whatever you do, keep on moving. Keep on trying. Today it might be very hard. It might be very tough. But you're getting there, guys. Like I said, consistency. That's what we're looking at. It's not an issue of perfection. It's not about how much of the workout you can do. It's how consistent you're going to be in terms of your workout, okay? Turn, Nelly. Give me 4 more. 4 more, Nelly. You're doing fine. Good job. 3 more. Only 3 to go. 3. Good job. 2 to go. If you can twist it all the way up, perfect. If you can't, do what you can. That's it. Emulate it to your level best. Good job, Nelly. Take a breather. Relax. Breathe. How are you feeling? Yeah, it's burning, eh? That's set number 1. So we're taking a 30-second breather. Relax. We're here. We're doing an active rest. We're here. March down. It's an active rest for at least 20 more seconds. Tuko hapa. Five more seconds. Good job. Nelly, are you ready? Come back to your position, Nelly. We're starting back again from the top. Tunaanza na biceps tena. Tuingie triceps. Sasa, tulianza na hammer curl with the bicep curl. So remember, bicep curl comes up curling. Your fingers are literally kind of facing you. With the hammer curl, it's the opposite. As if you're hammering something. All right? We ready?
Yeah.
Nelly, we ready?
Yeah.
Let's go. Hammer curl. Give me a hammer curl. Let's go. Give me a bicep curl. Give me a hammer curl. That's 2. 3, give me a curl, give me a hammer. 4, use whatever you can. Something light, something heavy, depends on your physical fitness level, guys. So give me what you can. Give me what you can. Twende kazi. 10 to go. 8 left. Nelly, good job. You're doing perfect.
Oh, yeah.
7 to go. Twende kazi. You feeling it?
Yeah.
Perfect. 6 to go. 5 to go. 4 left. 4 to go. 3 to go. 2 to go. You're doing fine. Last one. Relax, 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 relax. 10 seconds breather, relax those arms. From there, remember, tunaingia kickback with an overhead extension. If you want to challenge yourself, I challenge you, go into a squat position. Sawa sawa, only for the overhead extension. Here. You can also be engaging your legs at the same time. Sawa sawa, so tunaanza na kickback. Nelly, you ready?
Yeah.
Let's go, start. 1, 2, don't swing, easy, up. 3, 4. I want your body firm like that. Don't swing. I know most of us don't want to katabia ka. I know it's the rhythm. I don't blame you. I also do it at times. I don't blame you, but don't shake. Don't move your body. That's the rhythm I'm looking for. This is the muscle we're engaging, guys. So nakazi. 7, 8, 9, 10. 10 to go. 9 to go. 8 left. 7 to go. 6 to go. Last 5. Last 4. 3, 2, and 1. Perfect. From there, tunaingia the overhead extension. Like I said, Nelly, you're doing just the typical overhead extension standing.
Yeah.
I'm going to do mine on a squat position. Sasa.
Yeah.
So if you want to challenge and you want to engage your legs, this is the position to be in. Nelly, are you ready?
Yeah.
Let's do 1. Up. 3. Twende kazi. 6. 7, 8. Twende kazi. Yes, here, squat. Doing a sumo squat. Upper. Then engage them. Up. You can do it. You can do it. You can do it. 5 to go. 4 to go. 3 to go. 2 to go. Twende kazi. Last one. Relax. Ooh, breathe. Relax. Relax, relax. Perfecto. From there, tunaingia deadlift with a front raise. Okay? You ready?
Yeah.
Perfect. Let's go. Start. Front. 1. Twende kazi. Don't quit. 2. We're working on our lower back. I want you when you come up, mama straight, then straight. Perfect. Down. Then straight. Perfect. Is that 3? 4, 16 to go. Twende kazi, skuma. 5, tuendelee. Posture, back, back, back. Sawa, stuck hivi. Up. So shoot your bum out. Up. Twende kazi. Chin up, face forward. Good job, those are 8. 9 to go. Hey. Yes, yes, yes. Lower back. Very good for your lower back. 7 to go, Nelly. You're doing good. 6 left. Good job. 5 to go. 5 counts, guys. Only 4 more counts. 4 more counts. Twende kazi. 3 more counts. Twende kazi. 3 more counts. 2 more counts. Breathe. 2 more counts. Twende kazi. Last count. Good job. Perfect. Relax. Relax, relax. We're here. Listen, we can still get you to that physical body that you so much desire to have. Okay?
Yeah.
Just by you being at home, remember, tunakaa nyumbani kwa sababu serikali inasema tukae nyumbani so that we're able to fight this corona thing. So please kindly stay at home. We have lots of workouts for you, and like we said, engage us, give us your feedback. We want to make it more interesting, more variation, at least to be able to get you viewers at home to enjoy whatever we're doing. Okay? Twende kazi. That's 1. Good job. It's 2. You're only doing 20 reps. Only 20 reps. 3. Sisi wote tucheze our role and let's komesha corona. Sawa. Stay at home, keep your social distance, sanitize, clean your hands, wear your mask, be physically active, have a nice diet. All that will help us all. In case one of us contracts it, if you're physically active, it helps. Your immune system will be able to fight the disease. We are not saying you're going to get it, but we're saying let's all protect ourselves and let's all stay safe. Good job. Perfect, Andele. Good. Good job. Remember, like I said, if you cannot be able to do all that, just do a plank there and just stand still there. That's fine. Up or two. That's enough. Okay. Good job, Nelly. If you feel tired at some point, you can place your knees down on the floor and still be able to go on with the same workout. Push it, Nelly. You're doing fine. Good job. Good job. Tendele. Push it. Push it. 6 more counts to go, Nelly. Tendele, you're doing good. You're doing good. Good job. 3 more counts to go. Stay at home, stay safe. Let's work out, guys. It's doable. 2 more counts to go. Remember, stay tuned to NTV every day, Monday to Friday, 6:30 to 7 a.m. Okay? NTV TZ Nyumbani, courtesy of NTV. Me and Eve have a lot of goodies for you guys. Give us your feedback. How are you feeling? Good one?
Super exhausted.
Perfect. I hope you enjoyed the workout. I hope you have learned something that you can actually do at home to be able to strengthen your upper body. Do as many reps as possible. Do as many sets as possible. We're going to finalize our workout with a good stretch. Then we're done for the day. We'll do a stretch standing up. Nelly, you start here. No problem. I'm here. Come here, right?
It's not stable.
Yes. If you can. No, you're fine. Relax. Just breathe in, breathe out. Good job. Bring in the knee. Up.
Same leg.
Yes, same leg. If you can't balance, hold on to the wall or something else. Sasa, naelewa. The other side. Bring it in. If you can do this one, there's always a stretch. We do the one we do seated down. You can still do it the same. It's the same workout, the same stretch. The same stretch. Sorry, it's still the same stretch. Okay. Good job. You're here. The other leg. Good job. You're here. Twist the ankle one side. The other side. Stability maneno monyota. Haya, shikilia ukuta. You can hold on to the wall in case you're not able to stabilize. Just hold on to the wall there. Perfect. Just pull it in and just breathe. Just breathe. Good job. Then now from there we're breathing in, breathe out. Breathe in from here. Breathe in. Out. Twende. Breathe in. Out. Last time, breathe in. And out. Thank you so much. Stay tuned again tomorrow for another episode of NTV TZ Nyumbani. Thank you for keeping us company. Thank you for choosing NTV. Have a lovely day. God bless.
Bye.
Change can be disruptive, but Business Daily has got you covered from Monday to Friday. Get evolving trends, ingenious business ideas, and the latest tech content in the new market dynamic, and exciting lifestyle content in the new normal environment. Business Daily. More possibilities.
mind-blowing music and entertainment. Just move to NTV.
Madam, ulikuwa umesema ni emergency, umenitoa nyumbani nikupatie remote.
Unatuibia sisi?
Madam, hapana.
Sisi tunakulisha? Tunakupatia
Ni mimi Kush. Nitadeal na wewe one on one.
Get an 8-acre prime residential plot with soil merchants in Kisamis along Magadi Road at 148,000 Kenya shillings for cash buyers or 195,000 Kenya shillings for installment buyers. SMS plot to 21595. This is NTV.
Hello, East Africa. Many countries in Africa are also now several months into the pandemic season. So how has Africa been coping with the disease? This is the main focus of our discussion today. Good morning. My name is Joseph Warungu. This morning we're asking you, do you think that Africa will be spared the worst effects of COVID-19? Let us know your views. Send us your comments, your questions to hashtag New Normal and also our WhatsApp and telephone lines. So we're about several months into the coronavirus pandemic, and since the disease was first reported in a few African countries around February and March, we're using this opportunity this morning to take stock of how Africa is handling the COVID-19 pandemic. We're also looking at what lessons countries can learn or have learned from one another. We're also looking at what the experience of dealing with Ebola and eliminating it from West Africa, what lessons have countries learned from that? And to do all this, we have a panel of experts and health reporters from around the continent. Starting here in the studio, we are joined by Dr. Rudi Eggers, who is the WHO representative here in Kenya. Good morning and welcome.
Good morning, Joseph.
Okay, and we are also joined on our fifth floor newsroom studio by Anne Soy. Anne Soy is the BBC senior correspondent and deputy editor for Africa, who has wide experience of covering health and health crises around the African continent. Anne, good morning.
Good morning to you. Thanks for having me.
Okay, we'll also be joined by Dr. Joseph Lelo, who's the medical director at AMREF Flying Doctors, joining us from their offices at Wilson Airport. We will also have via Zoom Gloria Mutesi, who is a journalist and news anchor at the Rwanda Broadcasting Agency, who joins us from Kigali via Zoom. In Kampala, our colleague Walter Musije from NTV Uganda will also be with us. And in Nigeria, we'll be joined by John Ebokan, a journalist also from that country. And in South Africa, we will link up with Hitekane Magwedze, a journalist from News Africa in South Africa. We are also hoping to be in touch with Simon Jep, the journalist from Cameroon, who joins us via Zoom. And then all the way from Accra in Ghana, again via Skype, Essie Benewato, a health journalist from TV3 in Ghana. So those are the journalists, the experts who cover these health issues, as well as medical experts. Now, let me start with you, Dr. Eggers. Maybe just giving us, from where you sit, from maybe a WHO perspective, Where are we at in terms of the pandemic, roughly, in the African continent? Have we got some way to go yet before, before we see some drastic changes?
So thank you for having me, Joseph. Yes, so Africa seems to be the continent that is the late comer in this epidemic. We had it first in the Asian continent, Europe, then North and South America, and slowly the cases are increasing in the African continent. So I think we're still at the very beginning of the outbreak in the African continent. Some countries, such as South Africa and Algeria, have had steep increases of cases, but in many of the other countries, the actually increase has been quite slow. And this is to our benefit, really, because it means that the medical services and the health services on the continent can get ready, can put the systems in place to actually accommodate this. So actually, it's a blessing in disguise that we actually have got some time to properly prepare for this.
And as you say, because we've already seen the experience from Europe and America, hopefully Africa has had time to think about how to get their systems ready.
Exactly. So even in Kenya, we know that this period of 1 or 2 months where we know the disease is coming has been very helpful to put hospitals in place, beds in place, also to train staff, etc.
From your experience, are we testing enough around the continent?
Not yet. I think we are still at the beginning of the numbers of tests that have to be done. So here in Kenya, we do about 2,500 per day, and that has increased from about 800 or 900 about 3 weeks ago. So it's slowly increasing, but in fact we have to test a lot more, because it's only when we know where the disease is that we can really address it. In South Africa is probably the country that is furthest ahead in the testing. They are, wherever they're testing, finding many cases. So we are still far away from the point where we have enough testing. It has to increase a lot.
Okay. Now, and so good morning again. And from your perspective, covering not just politics but also health for the BBC, what are your views about how Africa is approaching or has approached COVID-19 generally?
Well, I agree with Dr. Rudy that Africa had time because since the first case was identified in Egypt in mid-February, we have seen the increase in the number of cases has been slow. What we saw with African countries is that they had been waiting. They had watched what happened in Asia and then Europe and then America, so they knew this was something that they could not take for granted. And as soon as that confirmation was made, we saw countries even that had not declared cases go into lockdown. So they moved in really fast. They took very swift and drastic action right at the beginning, and that helped to slow down the spread of this disease. However, you alluded to the levels of testing. That is a big concern because as long as you do not know how far the disease has spread in the community, then you cannot, countries cannot have in place the right measures to deal with it. That has been a big challenge for Africa, but we're hearing from the Africa CDC that they're ramping up that. They're trying to test at least 1% of the African population over the coming weeks.
Okay, now I know we are taking a Pan-African approach to our conversation this morning, but really it's not easy to compare, one country to another because of different approaches and so on.
Indeed, the approaches have been very different. The measures that countries have taken have been different. The models of testing have been different, and therefore it becomes very difficult to compare the rates of infection from one country to another. The UK, for example, very early on decided that people who were asymptomatic or had mild symptoms just needed to stay at home. They were not even tested. So they were testing those people who had more severe disease and who needed hospitalization. And therefore, when you compare the rates in a country like that and a country that has been testing virtually every contact of a known case, Mauritius, for example, they have tested more than 7% of the population. So it becomes very difficult to draw parallels because the models are different.
Yeah, same question to you, Dr. Eggers. When Kenyans look at South Africa and say, "Oh, look at their numbers. These guys are not doing too well," it's not a fair comparison.
No, it's not. I mean, the fact of the matter is South Africa's disease started earlier, so they had their first cases earlier, and in fact they are testing much more in South Africa. So if you had the similar rates of testing in Kenya, it is quite possible that you would have similar rates of infection identified. So I think, as was said a minute ago, it is really important to understand the context of that country, how they've responded to the travel restrictions, the school closures, etc., and then how they've done with testing.
And from your point of view, is the spread of the virus following any pattern that you know of or have seen now or in the past?
So I think it's, as we see this disease cross the continents, we actually see that countries are not that different. Actually, it follows a similar pattern. So there's a slight period where people say, well, maybe it's not so bad, and then suddenly there's an explosive growth, and then it sort of tails off as people realize the need to really be restrictive in their movement, etc. So the disease itself is teaching us how to go about it. And as was said, I think Africa responded very rapidly to actually put proper measures in place. So that's one of the reasons I think that the African continent has had a slower uptake of the disease.
And go on.
It is a little bit different to other diseases. Of course, it's not like Ebola. So Ebola requires direct contact of the infected person, and Ebola is actually much more lethal. Once you are infected, of course, the likelihood of dying is much higher. This is a disease that spreads through droplets, so you can't compare it directly with each other. So there are some lessons that we can learn from Ebola, but it's actually quite a different disease.
And across the continent, are we all dealing with the same strain of the coronavirus?
There are some differences in strains, so there are some genetic differences between different strains, but as yet we haven't found any change in the disease as a result of that. So it's not more lethal, it's not more infectious, so it seems to be those characteristics that make the important features of the disease are the same throughout.
Okay, and now, and Dr. Eggers, they're saying obviously this is very different it's a very different virus from the Ebola virus. But in terms of infrastructure and people's behavior, are there things that perhaps African communities and societies could learn or adopt from Ebola, the Ebola experience?
Absolutely, and we saw that lessons learned from dealing with Ebola were really helpful right at the beginning. There was an ongoing outbreak of Ebola in the DRC, and therefore the countries around the DRC already had in place screening facilities at the airports, and that was quickly turned to focus on COVID-19. Hand washing became a norm in the countries that were affected by Ebola, both the DRC as well as West Africa. And people stopped shaking hands. They were tapping elbows. It was called the Ebola when they covered the outbreak in West Africa. So all these measures were already ingrained in those communities and have been very useful in dealing with COVID-19. And just the sensitization that highly infectious diseases like these two diseases require a community approach, that has really helped those countries. That has been very useful in Africa because the health infrastructure is not, we have some of the weakest health systems on the continent, and diseases like these should ideally be prevented. That's the best chance Africa has to dealing with these diseases. It's by preventing rather than waiting for them to go to hospital, because the health systems can easily be overwhelmed.
And Anne, as well, from your perspective around our country and around Africa, the stigma has become an issue as well as criminalizing the coronavirus.
Indeed, and they are linked because when you criminalize the interventions, like we saw here in Kenya, in some other countries like South Africa and Rwanda and Uganda, there were serious cases of police brutality against communities trying to enforce restrictions of movement and other measures that had been put in place with the governments. That seems to have gone down now, but that was a major concern right at the beginning of this outbreak because then people, you push people into a defensive approach where they see this is a government thing and therefore we are not going to be really involved in it. It should be the other way around, where you go into communities, get their buy-in, and that is, we have seen from other outbreaks, that is the only way that you can deal with outbreaks of disease. Okay, now Dr. Eggers, some question to you on your comment on stigma.
So it's a major factor. Here in Kenya, we've had situations where people initially were quite cooperative in once they were tested positive in divulging their contacts, etc. And when they get the feeling that that actually is harmful, that other people will be stigmatized, they don't want to divulge that information. And for a disease like this, that is really a big problem, because the ability for the health workers and the public health workers to trace the contacts is paramount. It's really, really important, because that's the only way that you can really contain the disease. So this cooperation that we need from the individuals is really necessary, and it can really only happen if they feel safe about it, if they feel that information that they're divulging will not be used against them. We've also seen that some of the community feel hesitant to be tested or to even go to health facilities when they are feeling ill, because they feel that other members of the community might stigmatize them, might ostracize them for being perhaps COVID positive. And that is a big problem, because you really want to, in this context, be able to protect those that are COVID positive and make sure that they are actually taken care of properly without infecting others.
Okay, we can cross over to the Wilson Airport, to the AMREF Flying Doctors offices, where we're joined by Dr. Lelo. Good morning and welcome to Your World.
Good morning, Joseph, and thank you for having me.
And now, you spend a lot of time trying to reach out to emergency cases and so on, all over the place. What's your experience with COVID-19 so far?
So far, it's been quite challenging, because of the multiple restrictions that have been put in place by various countries in the region. We have, for example, in Kenya, we have to request clearance from at least 3 ministries before we move a patient into the country. We have to talk to the Ministry of Transport, Ministry of Foreign Affairs, and of course the Ministry of Health. So in an emergency, this can take 24 to 48 hours. So it is quite challenging, and from our point of view, the burden of disease in this COVID era is going up. We still have the other normal patients, the conditions we're used to, our heavy infectious disease burden. So we find ourselves stuck a lot of times, because latest directive now says we treat every patient as a suspected COVID case. Yeah, so we find ourselves stuck.
Okay, and Dr. Lelo, are you
able to act as quickly as we'd like?
Have you had to ferry or transfer a lot of critical cases as a result of COVID-19?
Yes, we have. I think almost 3 per week.
Where from and where to?
Most of them are moving either from Kenya to other countries, from a second country to a third country, and a few will be coming into Kenya.
And has that figure been on the rise, or is that just the kind of maybe regular number that you've dealt with?
No, the figure for COVID cases has actually been on the rise. Remember, we have a lot of persons who are stuck where they were when the travel restrictions came in. So these people have been affected by the disease. A lot of them would like to go back home. For example, if you have a Kenyan who's in another country, his primary desire would be to get back home. And so these are the people we are catering towards.
Can you give us a sense of the operation when you're dealing with someone who's critically ill from COVID? What are the protocols that you follow in order to transfer them to a medical facility?
These protocols are quite intricate, but in a nutshell, the first would be to ensure that all documentation and all approvals are in place. So we typically would have a lot of paperwork, getting landing permits, clearances from the relevant ministries, the civil aviation authorities, arranging ground ambulances on both ends. So that's a kind of preparation that goes in. And typically in flight we have negative pressure isolation units to prevent infection coming across to our medical crew and our flight crew. We put on the PPE, so it is technically quite demanding because of the PPE fatigue that we come across. You know, when you're in PPE and you wear PPEs for more than 2 hours, some of these places are very hot. For example, Khartoum, it's very hot, or Juba, 40 degrees even in the shade. So it is a technically difficult thing. We need to use extra crew that we were not using before for a normal case. Yeah, and even a simple thing like parking in the aircraft. Once the civil aviation authorities and the airport authorities know that you're carrying a COVID patient, the parking tends to be in a very remote part of the airport, so it is increasing the time and the difficulty and the strain on the patient and the crew as well. But I expect that this will improve as we go along, because we are learning a lot. I think the stigma is still on the rise, but with information, new data, I think things are going to improve and we'll have better outcomes and be able to serve patients much faster.
Okay, Dr. Lelo, thank you. Stay with us. So let me come to you, Ansoy, here in our Nation Center studio. And there are still, 4 months in, quite a number of people who say COVID-19 does not actually exist.
Right. There are many conspiracy theories, but we have seen who get sick. There's evidence everywhere. But during outbreaks of disease, especially pandemics like this one, you cannot rule out that there are people who will come up with conspiracy theories. We had many of them in the 80s and 90s with regard to HIV and AIDS. There were conspiracy theories even that we had to deal with and to demystify when dealing with Ebola in West Africa and in the DRC. Particularly, it was problematic in the eastern part of the DRC.
And when you look at the region, we've handled this crisis in very different ways: Uganda, Kenya, Rwanda, Tanzania. What's been your thoughts in terms of the various approaches from the East African sub-region?
Well, I think it is a great witness for Africa, because our borders are very porous. And therefore, when you have two countries that have completely different approaches, it really affects the people. Especially the people living along the borders. We have seen with the truck drivers, Uganda was very proactive with lessons learned from the spread of HIV. They quickly identified them as a high-risk group, made sure that they are tested. Kenya caught up along the way, but we're also seeing that not every country has taken that up. Truck drivers now are allowed to pass through Kenya. There's screening, there's testing in different points, and they are allowed to have a tout. But when they get to Uganda, the touts are not allowed. And so many truck drivers have been leaving their touts at the border and then crossing Uganda, because some of them go as far as the Democratic Republic of Congo. So this disjointed approach is a weakness for the region. We saw in the Southern Africa Development Community, it was more coordinated. And when South Africa went into lockdown, more South African countries also followed suit. And that has really helped that region. Namibia, for example, went for weeks without a case, and they were able to detect 2 cases when they drove in from South Africa. Because of that communication between countries. So that's very important.
And Dr. Eggers, again, in terms of approaches, we've seen countries that have reopened the economy far too quickly and have had to pull back. Even China is dealing with certain new waves. What's the advice or the experience from WHO in terms of how quickly you should open up society and the economy?
So there are very clear directives given by WHO on when a country should consider easing the lockdowns. Clearly, the risk is that there are still a lot of susceptible people in the population, even often outbreaks such as China or indeed Italy or Spain, even though it sounds as if everybody has been affected. In fact, probably only 10–15% of the population really has been affected. So there are still many people that can potentially get the disease. So it's very important that in a rising epidemic such as East Africa is experiencing, that the lockdown considerations are really taken very carefully. Because if you open up too quickly, you risk that suddenly that first wave becomes a prolonged wave, or if indeed you have passed the wave, that it actually starts with the second wave. And that's a real risk. We've seen it in China, we're seeing it in some of the other countries in the USA. New York has sort of gone over the first wave, but the other states in the United States are now seeing the resurgence of these cases.
Okay, and Dr. Lelo, if you're still with us from AMREF, now in terms of the coronavirus as a pandemic, can you think of anything that can compare in terms of how you've handled other public health emergencies?
I would compare it to the SARS outbreak that we had about in 2016. Yeah, because the mode of transmission, the coronavirus itself, because the SARS is also a coronavirus, so I would compare the impact on the aviation industry to what we have now. The SARS was a smaller version of it. What is different about this COVID-19 is the speed and the numbers and the infectivity. Yeah, so the SARS had a very high mortality rate, but when we compare with COVID, the mortality rate is much less, but the speed of spread and the economic impact we are witnessing, a near total shutdown of the aviation industry, tourism industry in our region. So the COVID-19 is a more significant outbreak compared to SARS. With Ebola, it was quite different because Ebola was well contained.
Now, Dr. Lelo, this may be a bit of a difficult question, but I'll ask it anyway. From where you sit, can you tell where we're at? How close to a peak in Kenya? Or, have we still got some way to go?
My feeling, looking at the numbers and the shape of the graph, is that we are sitting on it's like a double-edged sword, because my feeling is that we are not testing enough, but on the flip side, that our measures are helping the curve to flatten a bit. So we are working almost blind, because our testing rate of 2,000 to 3,000 tests per day is not adequate, because we need to test probably at least 1 million people to know that what the prevalence is, so that we know what real burden of disease we have out there. So we don't know. So I feel our measures are helping, but we still don't know exactly what is out there.
You work a lot with communities. What's the experience there with COVID-19?
On the community basis, I think the government is trying quite a bit to bring in the community health workers. I'm aware of a project coming up in Western Kenya, in Sia area, to get these community health workers to go and find people who are sick, and enhanced testing, enhanced prevention measures like hand washing, sanitizing, wearing of masks and distancing. So at a community level, the community health workers are key to enable us to find the disease and to bring these people to attention, and also will be a key source of data, because that's what we need right now, is proper information on the ground to know what is our actual disease burden. Is this COVID as bad, as significant as it is said to be in other places? We can only do that by finding the sick and testing them. Okay,
now, Dr. Eggers, these trials in the UK, the new steroid drug, whose name I cannot pronounce correctly,
yes.
Is that reason to celebrate, or is it too early?
I think the indications are that it is a positive result. So the scientists, of course, have gone through the due diligence of testing this properly. It is, however, a medication that is well known. So to some extent, it is something that we still have to continue testing. It is a sort of a general treatment against the inflammatory components of the disease. The first indications are that it is quite positive, so it does seem to be helping. WHO has got a protocol. We'd actually expand these kind of trials to go across many countries and across many people, so that we can be really sure that it is supportive. So early indications are good, but we, I think, have to reinforce it a little bit with further science.
And how far are we from a vaccine, would you say?
It's going to take some time. So I think probably by the end of the year or early next year, we might have candidate vaccines available. But even then, you have to scale it up to size that you get enough for the whole world to really get the vaccine. So that is really going to be a process. So even if you get the vaccine, let's say in March next year, 2 or 3 candidates, you will still have to really scale it up so that individuals across the world can get it. So it's going to take a time. I think it's not going to be, for now, we should not really focus on the vaccine, but really the preventative measures that we can take.
Okay, now let's cross over to Cameroon, to Simon. Good morning and welcome to your world.
Good morning. How are you?
Very well, thank you. How is Cameroon handling coronavirus?
Yes, Cameroon bring up some measure by the government, 13 in the 17 March, and on the 30th April, they bring up 19 measure up to improve the fighting against coronavirus. But tech and innovation Cameroonian contribute also to fight against this pandemic by making textile masks locally and wash hands with soap and water. They put it in all public places. This is our contribution. In the technological or traditional plant, we have a bishop, Samuel Kleda, who contribute by make a mixture by plants, forest plant, to treat those people who are contaminated by coronavirus. This is our contribution, or Cameroonian contribution, to fight this pandemic.
Now, Simon, that herbal medicine that you talk about, that traditional cure, has it been approved by government, by the Ministry of Health?
This herbal treatment, they are not improved because the government has stopped this man. But the Bishop Samuel Kleda treat the person who had catch this coronavirus. This is something that's special because he has declared 3,000 persons who get a coronavirus, half of them recovering their healthy.
Okay, now, Simon, what's the situation at the moment? Do you have a lockdown? Are people able to move about in Cameroon?
The lockdown, we are not the lockdown. Until the 30th April, the government above the time to lock the restaurant and bars parlor. In this period, Cameroonians think that there are things this pandemic. This is there's something that we know that is very terrible. We understand that our continent are not conscious about this pandemic. But now, the number of cases grow up. We are about 10,000. We are about 10,000. The cases of disease grow up too, and I hope in my mind that.
Okay, Simon, the line is breaking up there. We will come back to you. Thank you, Simon, in Cameroon. Now, necessity, they say, is the mother of inventions. Even amid the global misery of the COVID-19, across Africa, local engineers are doing their best to boost containment. efforts, especially in the area of production of ventilators, a key health-saving resource for persons with acute coronavirus. In Cameroon's Bafoussam, the chief regional city in the western part of the country, at the basement of an uncompleted building, engineers of Lange University, Paul University, have produced prototypes of the much-needed ventilator and a vaporized sanitizing door.
Necessity is a mother of inventions. Amidst the global misery of the COVID-19 disease, local engineers in Cameroon are making headlines with their recent products. In Bafoussam, the chief regional city in the western part of the country, at the basement of an uncompleted building, engineers of L'Agence Université pour l'Innovation have produced prototype of the much-needed ventilators and vaporized sanitizing doors. He says, so here we have the ventilator, its mask which goes onto the face of the patient, and then the tube which transports the air. As you can notice, is still a prototype, so other things still need to be put in place. So it works really simple, but it's difficult for me to use now because my breathing is affected by the artificial support system. The said initiative has been in collaboration with a local which has supervised previous productions, as the clinic serves as a platform to test prototype. Authorities in the town have also lauded this initiative as life-saving. And he says, we trust that the state will make available the needed support so that all these prototypes can become useful. The most important thing is that we can produce them locally, and with this innovation, it is clear that Cameroon has great engineers who can compete at international levels. The Yaoundé government is expected to evaluate and support mass production of these products made in Cameroon so as to curb the increasing threats of the pandemic.
Okay, and so back to you, looking at the various initiatives that different places are trying to come up with to help in the fight against robots in Rwanda and, you know, people building ventilators and so on. This pandemic has also created an opportunity for Africa to be a lot more, you know, for inventions and things like that.
Absolutely. And Africa was really pushed to do that because very early on we saw that access to medical supplies like personal protective equipment was very difficult because there was a global rush to buy them. And African countries, particularly the poorer countries, were pushed to the back of the queue. And considering that the outbreak came much later here, so that scramble for medical supplies meant that many African countries were starved of that, and especially of reagents, testing reagents. That has been a big concern for many African countries, and so they have been forced to innovate. The Institut Pasteur in Senegal, for example, has been at the forefront of doing this. They came up with a rapid test, which they said would retail at $1, and so we've been following that very keenly. They played a big role as well a few years ago during the big outbreak of yellow fever in manufacturing the vaccine that was needed. And so there's a lot of effort going on around the continent, and it's very promising. And I hope this is something that will go into the future so that more African countries will be manufacturing their own supplies. At the moment, 94% of medical supplies consumed in Africa are imported.
And if I can take you back again to Ebola, looking back to that crisis 2014 to 2016, what are some of the key things that helped to win that war against Ebola, would you say?
Well, working with communities, because as long as communities do not understand the modes of transmission, as long as they do not understand what role they can play in preventing the infection, as long as they do not come forward to be treated when they need it, then it's going to be very difficult to win any war against an outbreak of disease. And listening to my colleague in Cameroon speaking earlier, there was something else that, you know, stood out. In Africa, you cannot rule out traditional medical practitioners. They play a very important role. And during outbreaks of disease, we have seen that that role can actually help increase the rate of the spread of the disease. In Sierra Leone, for example, a very respected traditional healer was responsible for this was according to a study that was done at the time, directly responsible for the death of more than 360 people who attended her funeral. So when people started falling ill in Guinea, they were crossing the border to seek her services. She did not know what she was dealing with. She got infected. And of the people who attended her funeral, because they had rites, including washing her body, paying their last respects, 360 people got infected. So you can imagine how many more people, or rather 360 people died. So you can imagine how many more people were infected as a result. In Eastern DRC, at the beginning of the Ebola outbreak, they did not know what they were dealing with. And because hospitals are very few, the health system is really very weak, most of the people usually go to traditional practitioners. They call them tradi modern. And they did not know they were dealing with a highly infectious disease. And many of them got infected and died. But then they were brought on board. I went and spoke to some of them. They were trained about how to identify symptoms of Ebola and refer them to treatment facilities. So those have been very important learning points from those outbreaks.
Okay, thank you. And we'll take a short break. We'll be right back with Your World.
Nakuhitaji by Eric Smith. Dial star 811 star 933 hash. To get Asante by Pamba Mteule, dial star 811 star 934 hash. To get Fanyia by Jerila, dial star 811 star 933 hash. Skiza na Nation.
Along came love.
There has been a tragedy, sweetheart. What happened?
You repay me by taking the love of my life away from me? There's no point in being a good man in this life.
They are good people. They really didn't deserve this.
You don't exist! You don't exist!
However hard you try to deny it, I know it was you.
Along came love.
Along came love. In association with Blue Band Peanut Butter.
Madam, ulikuwa umesema ni emergency. Umenitoa nyumbani nikupatie remote.
Unatuibia sisi?
Madam, hapana.
Sisi tunakulisha? Tunakupatia
Ni mimi Kush. Nitadeal na wewe one on one.
Get an 8-acre prime residential plot with soil merchants in Kisamis along Magadi Road at 148,000 Kenya shillings for cash buyers or 195,000 Kenya shillings for installment buyers. SMS plot to 21595.
It's our responsibility to fully participate in ending this coronavirus pandemic. Let us know that early detection of the symptoms will ensure early intervention to manage the symptoms and a quick recovery from the disease. Let us therefore be vigilant and not anxious as we trust and believe in God, our source of healing and restoration, as stated in Jeremiah chapters 30 and verses 17. But I will restore you. I will heal you. I will heal your wounds, declares the Lord.
If you've just joined us this morning, we are looking at the Africa experience and COVID-19 experiences from different parts of the continent, with reports and experts who are joining us from various parts of Africa. But first, let's go to our neighbor here in Uganda, in Kampala. Walter Musije, again, my third good morning to you.
Yeah, good morning, Joseph. And finally, we are now clear.
Yes, thank you. Now, we played an earlier report from you with voices which are very critical about government's approach to COVID-19. Has there since been reactions from government?
The situation hasn't changed for now, because some regional referral capacity, hospitals are still dealing with, big numbers of patients that are much more than they can handle.
Now, Walter, has there been an explanation? We're almost 4 months into this pandemic in the East African region. Uganda has still not reported any single death, which is very good news. But is there any explanation, any medical explanation as to why you're doing so well?
Yeah, the explanation can be gotten from a study that was done by a couple of scientists here on the committee for COVID-19, who actually found out that the patients here that we have here who are sick are not, in the same age bracket as those who are dying elsewhere. I know somewhere, babies have lost their lives, but the argument is that our patients are much stronger. They have a much stronger immunity to fight off the infection. And of course, in the first days, there was, a drug that was being used, which now was stopped. That is, they're actually now doing clinical trials on it. But of course, the ministry did mention that it was very helpful in it. It's hydroxychloroquine. I don't know if they use it in Kenya, but here it was being used in the, to treat the very first batch of patients until it was later stopped. So we are now doing clinical trials, but the scientists who actually treated these patients say this drug was very instrumental in helping the patients recover.
Okay, now in the last few days, Walter, we have seen a lot of movements, especially to do with the Prime Minister's office and precautions for COVID-19. What's been going on there?
Well, I can tell you that our Prime Minister right now is still in quarantine, self-isolation, you would call it, after some members of his office tested positive for COVID-19. But the information that we got is that these people were drivers who actually, move around the country, and the last movement they had made was to Elegu border, which is close to South Sudan. And, South Sudan still now has quite a number of cases of COVID-19, and we get many of our cases from there. Ugandan truck drivers who fly that route come back with a positive result, and that's where they had gone. But, all that means that restrictions now are going to be put in place. We had partially lifted the lockdown, but when we keep on getting cases like that, and of course the ministry also came out to announce that Uganda is now in phase 3 of the infection, which means that there is a steady rise of community infections, locally transmitted infections. And about a week ago, we had 33. There could be probably more right now. And that is reason to worry for the ministry.
Okay, and my final one to you, Walter. The Ugandan leadership falls into the vulnerable group, people in their 60s, 70s, and maybe even 80s. Any concerns in Uganda about this?
Well, quite an interesting question, but what I can tell you is that there's been a lot of restrictions, ever since these infections started coming closer to, the offices around here. Actually, even where we are here at Serena, we are, next to the parliament and next to the Kampala Capital City Authority Hall, where some cases were tested there and they turned out positive. But what has happened is there's been restrictions to these places, and many of the people actually working in government offices have been told to stay home. Those who can stay there and work from there. And everybody now is trying to use technology to, continue with their work. So if you want to interview anybody, or if you want to speak to somebody from government, you really, really don't need to go to their office if you can get them on Skype. And of course, the president has also urged them to use technology because the government paid for some links. For example, Zoom, they paid for a Zoom link, a government Zoom link that they can use.
Okay. Walter, thank you very much indeed for joining us this morning. I know you have to rush off to a news assignment, so thank you and stay safe. Now, let's look at your comments. We asked you this morning, do you think that Africa will be spared the worst effects of COVID-19? And here are some of your thoughts. This one's from, you say you're calling yourself unconventional, Bravo Humphrey. It can't be worse than what the government has subjected its people with abject poverty. Okay, Humphrey, that's your comment. We have another one here from Jeremiah Masasi who says, God will take care of Africa. Okay, thanks for that. Piantu, you say rhyming words, Corona, Africa, money. Not too sure what you're getting at, but thank you for that comment, Piantu. This one is from Duncan Tanui. I don't think so. The problem with most of us Africans, we want to learn by our own experience. So we feel that we might still get really hit hard. Okay, Tanui, Asante. And then Abebe, you're saying, well, is coronavirus a pandemic? Yes, it is a disease with 99% recovery rate with a global mortality lower than that of a seasonal flu. Something that is already with us at community level and no one being taken to hospital because of COVID. All in hospital are because of comorbidities. Okay, well, thank you, Abebe, for that. Let me turn to you, actually, Dr. Eggers, whether we still qualify this as a pandemic. I suppose that's what our viewer there is saying, COVID-19.
Yes, it truly is a pandemic. I mean, if you look at the numbers, we've passed 8 million now. We're almost at 500,000 deaths. If this doesn't qualify as a pandemic, what does? And it's just not true that it is similar to the seasonal flu. Actually, if you look at the actual graphs, it is completely more harmful than that. So I think we need to get over this idea that this is just another seasonal flu that is hitting us. We really need to understand that this is quite a different disease and it really is harming everybody. We can see it also in the economic effects. So of course the lockdowns have the effects of tourism being reduced, travel of people across boundaries has been reduced. So there's the disease aspect and then there's the economic aspect as well. Clearly they are linked. But to think of this as not being a pandemic is wishful thinking. This truly is a pandemic.
We're in it and we have to deal with it.
Absolutely.
Okay. Dr. Lelo, to you as well, if you're still with us from Wilson Airport. Now, in terms of your operations, is it COVID that is keeping you a lot more busier than other kinds of illnesses and health emergencies?
I would say yes and no. What COVID has done is that it has created a lot of bureaucracy and a lot of paperwork that needs to be done before an actual flight can take off. So in the background of the other illnesses, I would say yes, COVID cases have really done a lot in terms of contributing towards the type of flights that we are doing now. The trauma cases have reduced, but the bulk of the work now is filing and applying for approvals before every movement, whether it's a COVID patient or not. So that is the impact we are going through. I think I would also like to add on to what the doctor has said regarding that this is actually a pandemic, which is very true. I think the projections are that should our containment measures fail, we might see about 100,000 patients across Africa requiring ICU care. So without the measures in place, that is a stark figure that we're looking at, and it's a very harsh reality for us with our poor and weak health systems. So it is something that needs to be taken seriously. It is a real pandemic and people are dying.
And unfortunately, you still pick up talk that either it's not there or it's not as serious as they say it is. You still pick up those kind of unfortunate comments.
Yes, we do. So there's a lot of that going on. I think it's mainly because of the economic pressure that people are undergoing, because 70% of our population relies on informal sector or subsistence kind of economy. So when we block access of these people to their livelihoods, I think that causes a much bigger crisis than the disease, than this COVID disease is actually causing. So it is that balance where we have the clinical effects of the virus, and then we have the economic burden that it is placing on people. And for most people, they would say the economic burden is worse. They would say that the cure, so to speak, is worse than the disease itself. So the sentiments are coming from that basis. I don't think anybody truly says that COVID is not there. What they are saying is that this disease is not as serious as it is made to be.
Okay, and Dr. Lelo, just give us a sense of what kind of places you've had to go to for medical evacuations, either within the region or beyond even our region.
I think over the past 3 months or so, we've been to a large part of Africa, the Greater East African region. So we are talking about Tanzania, Burundi, Rwanda, Ethiopia, and further outward to places like South Sudan, Sudan itself, Khartoum, Yemen, Germany, Athens. So we've been able to move, but as I've said before, that it is quite difficult now to do a lot of movement because of the various restrictions, and the restrictions keep evolving across the region. One day you might find a place is open, and tomorrow they say it's closed. Somebody might say, don't use this airport, use the other airport. So it's still quite a fluid situation, and we keep monitoring and making the best of it.
Okay, Dr. Lelo, thank you. Stay with us. Let me turn to you, Ansoy. Talking about the human impact of COVID-19, what's your sense of what people have had to deal with around the African continent in terms of how this has impacted lives?
It's a lot, and considering that, as Dr. Eje said, we're just at the beginning of this outbreak on the continent, I don't want to imagine what we should be expecting, but the toll has already been massive, especially when countries went into lockdowns. That has seriously affected livelihoods, and for many of the urban poor particularly, who have to work every day to be able to put food on their tables, it's a serious hit on their livelihoods, and something that threatens their lives as well. So it's a really delicate balance for countries, and this is not lost on leaders that I've listened to speak. They are concerned about the spread of the disease and how it affects lives, and the fact that with weak health systems, having a huge caseload or so many people affected by the disease will quickly overwhelm the systems. But on the other hand, they also have to balance that with safeguarding the livelihoods of people. So people who are in the tourism sector, their jobs have simply disappeared. People who are in the hospitality sector, some of them are beginning to come back, albeit very slowly. And so it is affecting everyone, every sphere of life.
Okay. Anne, thank you very much indeed. Now let me cross over to West Africa, to Nigeria specifically. John Ebokan, good morning and welcome to Your World. We'll just boost our volume here so that I can hear you clearly. What's been the experience of Nigeria with COVID-19?
It has been a mixed bag in the sense that the way it has moved. When it first came, the government did not do the needful. They didn't do the needful. They were supposed to act promptly. They didn't act promptly. So because they didn't act promptly when they were supposed to act, things now got out of hand. And when they now acted, all of a sudden, things were moving in the right direction. But because of the need to balance livelihood with life, they now eased the lockdown. Things have now gone from bad to worse again.
So
it's like a time bomb waiting to explode. Because when we look back at what happened in May, when there was a lifting of the lockdown, the numbers we had then were pretty manageable, about 500, 600 cases. But now we have 17,000 plus, because they want to balance the economic impact The hardship in Africa is known to all.
And
but
so, John,
what the government.
And so, John, even with the situation as you describe it, a lot of your health workers have gone on strike in Nigeria.
That's just another matter that is unfolding. It just tells you the state of the situation in Nigeria. We are in the middle of a pandemic. Now the frontline workers, the National Association of Resident Doctors, which are in the forefront of the fight against this global pandemic, they've now down tools because of issues dating back to 2014, which the government has been taking for levity for forever. So now those people now feel that these people are not concerned about us. They are not even giving us enough PPEs. They are not even giving us hazard allowances. So why are we fighting for all this? Why are we fighting? Why are we risking our lives?
So, John, for these communities that were complaining, poor neighborhoods that have not received, food aid or money from government, has that situation improved?
It has not improved. Even now, they are not doing that again. They are not doing that again. And you know, the African system is their system that they just want to. The government, they are really concerned about themselves. Even the people now feel that the government is making money out of this coronavirus pandemic thing. That's the situation. That's why the people they feel that instead of them to go hungry, like the place you just mentioned, Iwaya, instead of them to go hungry, let them fight this coronavirus by going out. They are even defying government because there's no restriction again. Even the curfew is not working again. People are moving about. People are not even wearing masks because they know that the people in government, they are not concerned about stopping this war. If they were concerned about stopping this war, I believe that they would have taken necessary precautions to stop the doctors from going on strike, because the doctors, they sounded this alarm long ago. But the government, the way they do their things, if it's about the government, if it's about taking care of themselves.
So, as you say, my last question to you, John, as you say, is there a danger that the rate of infections could go high in Nigeria?
Even the situation in Nigeria is that we have not even tested enough. This is a country with more than 220 million inhabitants. And how many have we tested? On average in a day, they are not even testing up to 3,000 in a day.
Oh,
so
okay.
The fear is that we have not done enough testing. We have not done enough community testing, and people are outside.
Okay, John, thank you. And thank you very much indeed for joining us this morning from Lagos. Wish you a good day and stay safe. Let me go to Rwanda now, to Gloria Mutesi in Kigali. Again, Gloria, can you give us a sense of how Rwanda has been dealing with COVID-19?
Absolutely. Measures here in Rwanda have kept changing from time to time, based on the assessments by the Ministry of Health. First from a total lockdown to gradually being lifted now, and at the current moment, most of the activities in Rwanda have resumed, with the latest being the tourism activities, especially with the charter flights and allowing international visitors that are only coming in via charter flights or private jets. And then Rwanda has also had some interesting ways of dealing with the pandemic, such as the use of drones in disseminating information to the public, especially during the lockdown period, and encouraging people to continue social distancing measures, as well as practicing hand hygiene. Last month in May, Rwanda also introduced the use of anti-epidemic robots that are now used in COVID-19 treatment centers in Rwanda. And the aim is to minimize contact between health workers and the patients, so as there's less contamination from the COVID-19 patients to the health workers. So that what the anti-epidemic robots do is they take patients' vitals, they encourage patients to wear masks if they are not properly worn. They are also able to read temperatures and everything. So all this information is registered in the robot, and the technicians are able to read it from the robots and then interpret it to the medical workers.
Now, Gloria, we see Rwanda as an orderly society. Do people tend to follow government guidelines in terms of what they should do to keep this virus at bay?
Yeah, mostly I think the community really understood from the get-go. The first time that we got the first case of COVID-19 infection in the country. And of course, there were measures that were put in place, such as curfew, and most people did observe the curfew, of course, with some that go beyond the prevention guidelines being punished by the Rwandan National Police. In that sense, they are taken to the national stadium and they are taught, they probably spend like a day there, and they are taught the importance of social distancing, and then like advocacy is really done so that by the time you're released from that stadium, you probably won't do it again. And so it's been most of the measures have been adhered to, with an exception of a few people that have gone beyond the prevention guidelines.
Okay, thank you, Gloria. Stay with us. Let me cross over to Ansoi. The experience there from Uganda, from Nigeria, I beg your pardon, that fine line between opening the economy, people who are hungry, and also, imposing these measures so that people can stay safe. It's a tricky one, especially for a lot of African countries.
It is very tricky, and they're also learning from further afield. China had already opened up, and then they even reopened schools, and we have seen that Beijing has had to close schools after a second wave of infections. And we're seeing other examples elsewhere. There are countries that had seemingly completely dealt with infection. New Zealand, for example, it had gone 3 weeks without a case of infection, and then there were 2 imported cases. So all these are lessons to African countries. And as I said before, with large populations of poor people living in urban areas who depend on casual jobs to be able to feed, it becomes even more difficult. There are countries that have tried to reach out to these people to distribute food. Some have been giving them cash transfers. For example, here in Kibera in Nairobi, there are organizations that have been doing cash transfers to families that are vulnerable. But in the long term, it's going to be a huge challenge, and there are hard decisions that will have to be made going forward to balance between saving lives and livelihoods.
Okay, now, Dr. Eggers, there's been a lot of back and forth from WHO in terms of recommendations. For example, is this virus transmitted via surfaces? Is it airborne? Where are we at in this conversation?
So I think WHO has from the start said that this is a virus that transmits with droplets. So it's a little bit different to seasonal flu that is truly an airborne disease. The implication is that droplets actually do settle down after a few minutes. So even if a person coughs or sneezes, while it is initially in the surrounding air, within half an hour or so, those droplets have settled. Whereas an airborne disease, of course, it remains airborne for longer. So that to some extent is helpful to us. So things like wearing a mask actually protects the surrounding people from the saliva, etc., of the person. So it's more protecting other people from yourself than actually being protected yourself. So it is quite important to realize that this is a droplet spread, and a thing like a mask is actually quite helpful. On the surfaces, the virus, if it remains moist, does survive for some periods of time, but just basic cleaning, even cleaning with basic soap, actually takes care of that problem. You don't need hugely chemical attacks of the thing. Just basic cleaning actually deals with the surfaces quite well. The same thing with hand washing. Really, the best thing to do is just water and soap. You don't actually need sanitizers. Water and soap is actually a very effective way of dealing with this virus. So I think it is a virus that spreads through droplets, so it goes through the air, but it does settle, so it doesn't remain in the air for a very long period.
Okay, now, Dr. Eggers, looking forward to Is it too soon to start talking about recovery of societies and countries in Africa?
No, I think it's actually a good idea not to lose track of a recovery. So even while we are preparing and we're getting ready for the current outbreak and making sure that we are ready, some people should actually be paying attention, well, how do we continue, especially health services. So there's some of the health services that even while we've got these outbreaks have to continue. Mothers still get pregnant, they still have to deliver, children still have to be vaccinated, malaria cases still have to be treated. So that part of the health services really has to be continued and been taken care of. Otherwise you will get sudden surges of malaria and tuberculosis and other diseases. So certainly while we are very focused on dealing with the COVID outbreak, many of the people that are out there should also be paying attention to making sure that the health services actually continue to run for the essential services. And that's of course true for the other economic aspects, making sure deliveries take place, the logistics are there, even in the tourism in those areas, as far as is safe to do.
Okay, and so a same question to you. With this massive focus on COVID-19, what's happened to our other illnesses and diseases? Have they just disappeared, or are we just focused on this COVID-19 for the moment?
Indeed, that's an important question to answer, because what we know is that during the Ebola outbreak in West Africa between 2014 and 2016, more people died from malaria than from Ebola. And therefore, whilst focusing on a new disease, on an epidemic, it is important not to lose focus, as Dr. Eje says, on the other diseases. Malaria kills more than 400,000 people a year, the vast majority of them in Africa. There's tuberculosis as well, AIDS and many other conditions, including pneumonia. So it's very important that countries do not lose focus of this, because you might save lives that would have been taken away by COVID-19, but then you might lose more people to other diseases.
Okay. Gloria in Kigali, let me come to you now. What sense do you get of how soon Rwanda might begin reopening up, maybe even allowing airlines to fly again?
Well, the recent development of allowing the international charter flights is certainly a good sense of direction towards what could happen for the next flights as well. But that is all dependent on the assessment by the Ministry of Health and the health officials in Rwanda, dependent on how the case load will.
Very sorry, Gloria. Let me go to Amref and Daktari there. What is your sense of the steps that you mentioned? The importance of maintaining, or certainly the lockdown and other restrictions have really helped. Do you get the sense that this is the journey we need to continue on?
Yes, I do agree that the measures in place are measures that need to continue, but it would be foolhardy to assume that we are going to stay this way forever. So AMREF is currently involved in training with the regional airports to enhance the preparedness to this outbreak in terms of getting them ready when the airports reopen. We have seen Tanzania has already reopened. They have invited tourists, although the flow is quite slow, but we are getting the airports ready, we are getting the staff ready. So I anticipate within a month we expect to see some positive movements. We see in Kenya that the restrictions are slowly being lifted. The curfew hours have been reduced. Slowly we'll have hotels reopening, restaurants are reopening, and the airports are also ready for reopening. So it's just a matter of time, but everything must be guided by data.
Okay.
Accurate data is something we have very little of.
All right. Now, Ansoy, to you, as we look forward to life post-COVID or opening up the African economy and so on, from where you sit at the BBC, what do you see as some of the priorities that we will need to begin to focus on as we look forward to reopening the countries once more?
Well, the challenges ahead are huge. from the economy. We already know that there are predictions that countries will go into recession, this region for the first time in 25 years. So there will be a lot of reorganizing of the economies. The public health system, I think, will come into sharp focus. And I think this is something that will be positive in the sense that countries will start taking public health much more seriously, particularly here on the continent. At least we hope so after this experience. And virtually every aspect of life is likely to change, even the way people relate to each other. Are we going back to shaking hands? Is that something that people will consider getting rid of completely? Will we be washing our hands more frequently? Which is a good thing because it not only helps to prevent COVID-19, it helps prevent many, many diseases. So my hope is that our behaviors as human beings are going to change for better in terms of preventing disease.
Okay, Dr. Eggers, we're already talking about potential second wave in the US, possibly in the UK. We've seen a bit of it in China. How worried should we be about second wave?
So I think the second wave is really a function of how we behave. So really the focus at the moment is let's deal with the epidemic that is in front of us now. So let us get the feeling of frustration that people are feeling, the feeling of complacency. Let's deal with this now so that we can deal with the issues at hand. So things like washing hands or wearing of masks are things we can do right now. Ultimately, the governments go through the process of deciding when the lockdowns can be eased, and that's the point where we can start talking about second waves, etc. Clearly, the experiences across the world are going to be beneficial to the African continent. We'll be able to learn from that and really have a new way of dealing with each other. So things like working from home, having distancing at workspace, restaurants and hotels, etc., dealing with customers differently. All those things will be part of how we're going to learn on that. But for now, our focus should really not be on the second wave. We really need to deal with this first wave at the moment.
And again, just before we leave that, delays can be quite costly. We've seen countries like China, when they see any signs, they move in very, very, very rapidly. So a quick response is really vital.
And I think that's the good thing that really Africa has learned from the rest of the world and really is part of that Ebola experience. So I think Africa has experienced that if things like diseases go wrong, to act very rapidly is very important. It actually does prevent a lot of disease. We know that from modeling in the New York area, had they started the lockdowns a week earlier, they would have prevented many cases and many deaths. So I think this immediate response as quickly as possible is something that Africa is doing very well and really is part of that Ebola experience that we have learned that if diseases go wrong, you actually have to act very quickly.
Okay, let me come to you, Dr. Lelo, at the AMREF offices. What do you think we need to do as a society to prevent or to, push away, as far as possible, the worst effects that we've seen in Europe and other places for Kenya and Africa?
I think there's a lot we can do, but at the heart of it is to customize the response to our African realities. Remember, we have issues to do with poverty. We have this overcrowding in our urban areas, in the slums. We have a very high infectious disease burden and a lot of difficulties with access to quality healthcare. So solutions for us must be our own. It's very hard for us to derive from China what they're doing because their situation is different, their resources, their economy is very different from ours. So solutions must come from us. I like what we talked about, that innovations are coming up in various African countries towards this disease. And also simple things like procurement. If we procure from our own local homegrown solutions, and I think will also boost our economy. So yes, there's a lot we can do, but in terms of going forward, keeping up the measures, I think those are important. We must continue hand washing, distancing, wearing of masks, those are important. But going forward, I think we need more information to be able to determine when we can actually say, okay, it's done.
Okay, Dr. Lelo, thank you very much indeed for joining us from AMREF this morning. Have a good day and stay safe. We can now cross over to Accra in Ghana to SC. Good morning, SC, and welcome to your world.
Good morning, Mr.
Okay, now, give me a sense of how Ghana has been dealing with the COVID-19 situation.
Well, so on 12th of March, we started recording cases. We had 2 cases, and since March 12th, when the first announcement was made, we have consistently been recording cases. So even as we stand now, we have about 12,950 confirmed cases. We also have 8,144 active cases. And in all these figures, we're having 66 deaths. And the deaths also from just 4 or 5 days ago, when we had about 56. Now we've jumped to 66 cases, and that seems to be a worry for health authorities. But since we started recording cases, governments every 2 weeks or every week comes to announce to the public or to Ghanaian populace how the country is helping. Government was dealing with the situation. So we had, first of all, we have the closure of the borders, closure of the airports. Some systems were put in place at the airport. So we had the Kotoka International Airport, where initially I visited, and we had health declaration form. When during Ebola time, when people were coming into the country, you need to fill some of these forms. Then when COVID set in, they enhanced, the surveillance, and they enhanced the information on the health declaration forms. Gradually, as time went by, there was the need for us to adhere to some protocols, the social distancing. We're talking also about the wearing of face masks. Now here in Ghana, it is mandatory. Everyone needs to wear the face masks, even though some people feel so reluctant to do so. And also, at the various hospitals, everywhere you go, it was very difficult for you to get into a facility without wearing of the face mask. So you could see inscriptions on walls, entrances to banks and all those places, indicating that if you don't wear the face masks, you are not going to you're not going to enter into any of these places. So there were a lot of incentives, and there were a lot of protocols put in place to ensure that we halt the spread of the virus.
Okay, now, and Essie, just briefly, what have been some of the key challenges? Are Ghanaians generally well behaved when they do what they're told to do by the authorities?
Well, initially, when people saw the cases in the U.S., in Italy, and elsewhere, it put some kind of fear in people. So you go to the banks, those companies that were allowed to operate. So you go to the banks, you go to the hospitals, and there's a thermometer gun, pointed at your forehead, checking temperature, ensuring that people wash their hands before they get into facilities and all that. So from March, when we started recording, when the cases started increasing, people were really adhering to the cases, even to protocols. Even when we're recording the numbers, it was very low. But now look at where the numbers are, 12,000 and over. Now people are really feeling reluctant to do so. So just last Sunday, President made it mandatory for people to wear face masks. And trust me, get onto the streets of Accra and you'll find people blatantly, not regarding some of these protocols. So wearing a face mask, social distancing, it is something that, we have thrown to the dogs a long time ago.
Essie Benoit, thank you very much indeed for joining us from Accra, from TV3. Thank you and have a good day. Stay safe. Now, as we come to a close, last thought, Ansoi, what are you missing the most?
Well, I think there are many lessons to be learned from dealing with this pandemic, and the more seriously it is taken, the better for everyone.
Okay, Dr. Eggers, your closing thoughts on this?
So let me say 2 things. The first thing is communication is really important. And I'd like to commend the Kenyan government and the governments across Africa that really have been out there in daily briefings telling the population what is going on, and the media really keeping everybody informed. The second thing is the risk of the individual is truly linked to your behavior. If you follow the directives, you wear the mask, you wash your hands, you do the distancing, your risk is actually quite low. But you really have to take that responsibility for yourself and for the people around yourself.
Okay, Dr. Egas, thank you very much indeed. And my thanks to all our other guests, and Soy from the BBC, Dr. Joseph Lelo from AMREF, Gloria Mutesi in Kigali, Rwanda, Walter Mosije, NTV, Uganda, John Ebokan from a journalist in Nigeria, Hitekani in South Africa, Simon Jethro in Cameroon, as well as Esibenoa Oto. Now, just before we close, let's look at some of your comments. I can squeeze in a few here. We asked you, do you think that Africa will, will be spared the worst of this coronavirus effects? I don't think so, says Tyson, the biologist. I know COVID-19 is not in Africa. Wow, really? Okay. Ben Kaimi say, we only have business in Africa, we don't have the virus. Okay, this one is from Anthony Mushoba. We can only speculate. Let's wait for the actual outcome. Indeed we are, as we do our bit. Winchester Oleokila, well, there's a silver lining. Africa will weather the storm. Okay, words of hope there from Lila. And then from Gilbert.